This is a delegation question. So in this question, we have a nurse and an unlicensed assistive personnel. So this would be like a nurse's aide, a nurse's assistant, a CNA, but for the purposes of NCLEX, they call these professions unlicensed assistive personnel, so UAP. And we're caring for assigned clients on a telemetry unit, and we're being asked which of the following tasks would be appropriate for the nurse to delegate. So in this case, we have one task that's appropriate and 3 tasks that would be inappropriate to delegate. So we need to figure out which one. Let's remind ourselves what we know about delegation. So we can review the 5 rights of delegation. And again, this comes from our delegation cheat sheet that you can look at. We need to make sure of a couple things when we're thinking about delegating a task. So we need to ask, is this delegatee, or in this case, this UAP, competent to perform the task? So do they have the skill and knowledge necessary to do this task? And then we need to ask, is it the right task? Is it within the UAP's scope of practice? Is it a routine task with an expected outcome? Does it have an established procedure that we can have them follow? Is it the right circumstance? So is this client stable? Can the RN supervise? We need to have the right communication. So did we give clear instructions? Did this UAP verbalize they understand what they're being asked to do? And can we provide adequate supervision? Because remember, the RN is always responsible for tasks, even if they're delegating. And so we need to be able to evaluate that task that was completed to see if it was done correctly, right? So let's go back and see if we can figure out which one of these would be appropriate, kind of knowing what we know about delegation. So our first option is to monitor telemetry recording for cardiac arrhythmias. What do you think? Would this be an appropriate task to delegate to a UAP, a nurse's aide, a CNA? Same thing, right? What do you think? I feel like probably not, right? Because monitoring telemetry recordings, they need specialized knowledge and training on rhythm interpretation to be able to know what they're looking at. So we might have like telemetry text, right? But they have specialized knowledge and training in reading cardiac rhythms, right? So probably not okay to delegate. They don't have the specialized knowledge and training to do that. Okay, so we have number 2. We have a client, educate the client about the purpose of telemetry monitoring. What do you think? Is it within the UAP scope of practice to educate? No, right? That is an RN task, so not within the scope of practice of a UAP. So I don't think we can delegate that one either. What about number 3? Apply telemetry leads to a client with new onset AFib. I think people get thrown off on this one because they see new onset AFib, but can a UAP apply telemetry leads? We're just asking them basically to put some stickers on, right? That's a routine task. It has an expected outcome, right? So we know we can go in there and look and be like, yep, those leads are placed in the right spot. We can evaluate that. So I feel like that would be okay, right? We're not asking them to interpret anything. We're just saying put the leads on, right? So I feel like that would be okay. How about number 4? Adjust the alarm parameters to limit insignificant alarms. I don't like this one because insignificant alarms, who's deciding what insignificant is? And so if we just say, go set the alarms just to eliminate insignificant alarms, they're going to have specialized knowledge on that patient's clinical status to determine what is an insignificant alarm. And so we can't delegate, right? That comes from nursing assessment, knowing that patient and knowing what would be insignificant. We don't want to leave that up to somebody who doesn't have specialized knowledge and training to determine what is or is not insignificant, right? Now, if we were to give strict parameters for that, that might be a different story of like an exact number. But if we're just saying go eliminate insignificant alarms, that's probably not going to be okay, right? Okay, so that leaves us with 3. And I see a lot of people chose that. So what do you think? Were we right? All right, yes, we were correct. 54.5% of people in our bank got this correct. So you guys are doing really, really well.